Hi, I'm Dr. Harry Oken for Columbia Matters. This month we're going to be talking about bone health, in particular osteoporosis. As we age, all of us lose bone density. It begins around the age of 35 and then starts to accelerate, particularly for women, after about menopause, which typically is somewhere between 45 and 55. As women go into menopause, they lose estrogen, and estrogen really helps women particularly keep up their bone mass. So osteoporosis and osteopenia are stages of bone loss which actually promote fragility of the bones. And so women and men who have osteopenia and osteoporosis are at much greater risk for fracture. The most common areas of fracture for patients who have osteopenia and osteoporosis are the hip, the wrist, and the backbone. In particular, the backbone actually can occur when one gets a compression fracture, where the bone actually compresses on itself, almost like a crushed can. These are particularly painful. When an adult has a fracture of either the wrist, the spine, or the hip, that constitutes a significant risk for another fracture, and those patients are thought to have osteoporosis. Now, there are other risks for osteoporosis. They include Caucasian and Asian race, heavy smoking, excessive alcohol use, use of certain medications like steroids and anti-seizure medication. All of these things promote increased risk for osteoporosis. And if you're osteoporotic, your fracture risk is much higher. To gauge this, we can do certain tests. One of the tests that's promoted, particularly for women after the age of 65, unless they have risks, is what's called a DEXA scan. A DEXA scan is an X-ray study to evaluate the density of the bone in key areas, particularly the spine, the lower spine, the lumbar spine, the hip, and the wrist. The DEXA scan is a non-invasive test where we take X-ray pictures using very low levels of X-ray to then calculate the density of the bone and compare that density to what is expected at age-matched controls. When the DEXA scan actually shows a T-score greater than -2, we term that osteoporosis. Less than -2, a T-score, is thought to be osteopenia. When this is diagnosed, we definitely want to take some extra special steps at keeping this from getting worse. The most important aspect to the treatment of osteoporosis is addressing lifestyle. Exercise can be very important for any exercise that is weight-bearing. So therefore, if you were a heavy cyclist or a heavy swimmer, that wouldn't necessarily help you. But if you like to work out with weights, walk, jog, these would all be important exercises which would put stress against the bone and then cause the bone to remodel and get stronger. That in the presence of a good diet, which includes plenty of fresh fruits and vegetables, which are high in calcium, a little bit of dairy, nuts, some cheese, whole grains are all helpful in giving us the calcium you need. Now, what about calcium supplements? Should you take them? There are some people that absolutely need to take them to get adequate supplementation. However, most people can get the calcium that they need from their diet, and that's advisable. In fact, there was recently a study, in fact 2 studies, which showed that women who took calcium supplements may have a greater risk for cardiovascular disease. That may be because the calcium that they're taking is staying in their blood and not getting into their bones. This brings us to another important piece to the treatment of osteoporosis, which means we want to have adequate vitamin D, particularly vitamin D3, in our system so we can absorb calcium properly. There's a large group of people who are actually vitamin D deficient, and if that's detected, you should be supplemented. In fact, most adults benefit from at least 1,000 to 2,000 units of vitamin D per day, and it should be vitamin D3, the active compound. Well, we still have the work of moving the calcium into the bones. And for that, we've actually recently recognized that there's another vitamin called vitamin K2, which promotes the movement of calcium along with vitamin D into the bones. And for that reason, you should talk to your doctor about a possible supplement of K2. I typically recommend for all my postmenopausal women that I'm concerned about either low bone density, osteopenia, or have osteoporosis, a significant low bone density, to take vitamin K2 on the order of 45 micrograms to 100 micrograms a day. Sometimes you may need medication. This is the decision that you'll make between yourself and your doctor depending on the severity of your problem and the need to prevent a future fracture. Keep your bones healthy and make them healthy by good exercise, good nutrition, consider supplements, and speak to your doctor about being periodically evaluated for osteopenia and osteoporosis. This is Health with Dr. Harry Oken.